So radiofrequency ablation location. So just to hit home the point I was just starting to talk about, for atrial flutter, we're talking about the location between the tricuspid valve and the IVC, right about there. When we're doing ablations for atrial fibrillation, we're going to do the ablations usually in the left atrium. Okay, so remember, atrial flutter, we're talking about ablations in the right atrium. Atrial fibrillation, we're doing ablations in the left atrium. Okay, and essentially what we're doing is we're burning off that pathogenic foci that's generating those pathogenic electrical impulses. So the exact location usually is either, they'll usually say left atrial myocardium or pulmonary vein ostia, which is going to be this area right here. So you can see these are the pulmonary veins coming in. That's usually the area where we would do the ablation. So just kind of try and keep these straight. Now, the one exception to this, let's just say that we have a patient that has atrial fibrillation. Maybe they had ablations in the past. But one thing that can happen with our patient is they can go into AFib with RVR. What does it stand for? Rapid ventricular response. Remember what I told you. I said that the AV node is responsible for kind of slowing the conduction that's coming from the atria down to the AV node and then the bundle of His. It's responsible for slowing that so that the atria can contract first and then the ventricles can contract later, right after that, so that it's coordinated. But if the AV node isn't working correctly, or if there's some pathology here, then we can have impulses that are rapidly being sent to the ventricles, and we can have AFib with a very high heart rate. Okay, with a very high heart rate. And in those situations, if they ask you, hey, this patient has atrial fibrillation and we want to do an ablation of the AV node, don't get tricked into picking that the ablation for the AV node is in the left atrium, because it's not, right? The ablation for the AV node, I told you where the AV node was. The AV node is on the interatrial septum. So you just have to be careful. If they give you a patient with AFib, they ask you where's the most likely site of the foci, or if they say that they're doing an ablation, just know it's usually going to be left atrium, pulmonary vein ostia. If you're doing an ablation of a different node that they're specifying in a question, just make sure you know where it's located, right? SA node is going to be more superior roof, superior vena cava, and then we said AV node is going to be more intraatrial septum.